I'm 26 years old. I've been struggling with endometriosis for over a decade now. In my early teenage years, I started getting intensely heavy periods to the point that I had to wear 2 night pads at all times, just back to back. And I even contemplated at one point getting adult diapers, which thankfully my mom talked me out of it. I was regularly bleeding through my clothes. I was leaving stains in my bed, in cars, in classrooms, basically any light colored surface I could find. I was leaving a stain. By the time I was around 18, 19, I had to miss class and work regularly while I'm on my period. It was, severe pains every other month, not every month. And then it became a pattern where I knew that if I had a normal period one month, the next month was going to be awful. About a year after that, my parents took me to a general specialist who dismissed my pain without further checkups and said that it was just my body changing at this age. The pain then became a monthly occurrence, and another doctor suspected PCOS, which, my symptoms were not anything close to what I know now are the symptoms of PCOS. And at that point, I started to lose faith in doctors, and I decided that I was just going to accept that my pain was normal. It was unfortunate, but it was just fine. Over the next few years, it then got progressively worse. My pain was so severe that I would feel sick and throw up for days at a time. I tried every painkiller I could get my hands on. I took so much that now my stomach has a sensitivity to painkillers, and it wasn't helping. Eventually got really bad that I was taken to the emergency room every month, getting a shot, getting an IV combined, just to temporarily ease the pain. My dad would have to carry me to the car because I could not sit up straight or, let alone get out of bed. I then started to develop other symptoms. So I started to have pain outside of my period, outside of my menstrual cycle, this like stabbing pain that was combined with like a heaviness that felt like my insides were just being pulled down. Painful bowel movements, just using the bathroom was a nightmare. I wasn't able to hold in pee because it hurt too much. So if I needed to pee, I had to run to the bathroom, and even that was painful. And I had extreme bloating. It was so painful, and I'm not exaggerating when I say that I looked like I was pregnant in my second trimester when I would get the bloating. At that point, I decided, enough is enough, and I'm going to start looking for another doctor again and start this journey again. In the span of 2 months, I saw 4 doctors, one of which misdiagnosed me with fibroids, and the 3 remaining actually found the large blood cysts that were, and they were covering both of my ovaries, and suspected endometriosis. I started to hear about endometriosis at this point. At the age of 22, I was told by all of these doctors that my ovaries had to be removed and that there was no way around it. I finally found another doctor who agreed to perform laparoscopic surgery to remove the cysts, clean up the endometriosis, and keep my ovaries. So the surgery was successful, and I wasn't placed on any treatment after. To my surprise, less than 2 months later, I was in severe pain again, and I knew that something was wrong. I went back, and my doctor found new large cysts again, and they were growing aggressively, and I had to undergo surgery again, just 2 months, 2 months later. Following my second surgery, I was then placed on Zoladex injections for 6 months, which, essentially put you on menopause. The side effects were unbearable. Hot flashes, pain, weight gain, joint pain, and severe depression to the point where I was suicidal. After the 6 months, I switched to Visan, which is quite similar, I guess, but it's a pill format. And that was the point where I learned to listen to my body. And I informed my doctor that this treatment was just not working for me. I felt like my body was just rejecting these hormones. I was still in pain. I was doing a monthly checkup, and they found a new cyst again. This time it was small, and my side effects were only getting worse. At this point, I was surprised that he dismissed me, and I don't know if he was just sick of hearing me complain on a monthly basis. So I was just told to just continue the treatment, and it was going to be fine. So I decided to see another. I decided to seek another opinion. It was really frustrating and devastating because I thought that I had finally found someone that understood. only to find myself, in the same cycle of being ignored all over again. I was back at square one. The next doctor I crossed paths with told me that I had severe adhesions that permanently damaged my tubes, and that I could never have children. And it wasn't a thing that I was thinking about at the time. And I still don't think about it, but you don't want to be told at the age of 22 that you could never, if you changed your mind one day, have that option. So at this stage, I gave up. I got off my medication and I decided I'm just gonna leave it up to the universe. I wasn't gonna do anything about it, and I was just gonna take it month by month and live with the pain. Until one day, I'm driving in the car. I'm driving with my partner, and I suddenly need to pull over because of this severe pain, which at this point, the pain was ongoing. But that day, something was different. It was, I couldn't continue to drive. I wasn't even on my period. It was a stabbing pain. Pulled over. And my partner, who was trying to convince me to continue to seek other opinions, he convinced me to just Google endometriosis Dr. Dubai and call, who I could find. To my luck, I found Dr. Marlain, and she agreed to speak to me on the phone before I met her. I was speaking to the reception at the hospital, and I was like, I don't want to see another doctor. I want to talk to her on the phone first. I just wanted to hear what she would have to say. So she agreed to speak to me, and I will never forget her kindness that day. I was in tears on the phone, and she calmed me down. She told me I was going to be okay, and she told me that my previous doctors were idiots for telling me that I couldn't have children. So I was sold immediately. After meeting her, we agreed to have a third surgery to remove the adhesions, to repair my tubes, and as some of you shared, also sort of repair the damage that was caused by my previous doctor. I was placed on birth control instead of strong hormone treatments, and I've never felt better. I now have regular periods with minimal to no pain. I feel like myself again, and I feel like I'm not bound to my cycle. So, while some of you may relate to my story, as Dr. Marlain mentioned, we each have our own individual experience with this disease, which is what makes it so fascinating, but also difficult to understand. What I'm hoping that through my story you can take away is three things. The first thing is, for a long time, I knew that something wasn't right, and I had no solid explanations. Getting diagnosed and going through this journey was sad, it was frustrating, but it was also relief. I felt like I was finally validated by the fact that I had a diagnosis. I felt like I could go back to every boss or friend or person who undermined my pain and tell them that they were wrong and that I was so much stronger than they could ever imagine, and they could not tolerate half the pain that I'm able to tolerate. So, it took me 6 doctors to finally find Dr. Marlain. Take as many opinions as they need to, listen to your body, do your research, and don't give up on yourself. The second thing is, talk to your friends. You'd be surprised how many women suffer in silence and pain thinking that it's normal. I now have 2 friends who got an endometriosis diagnosis recently because I insisted that they go get checked out, and I convinced them that it wasn't normal to be in this much pain despite what we're told. And the last thing is, if you're comfortable to do so, and this applies to you, talk to your employers or to your teachers or the people around you. Explain that you have a chronic disease that can make it seem like you're fine one day and then unable to get out of bed the next. Explain that you're doing everything you can to manage the symptoms, but some days the best thing to do for you is to stay at home. Just because one of the main challenges is getting, your employers or your teachers or wherever you are to understand why you just need to take some days off, even though they saw you in the office yesterday and you looked like you were completely fine. And so with this, when I spoke to Dr. Marlain over 2 years ago, I was thrilled to see her passion about endometriosis and her goal to create this supportive community. So today I am so grateful to be able to be part of this initiative and to hear everybody's stories. And I really hope that my story helps reduce the stigma around this disease and encourages others to listen to your body. So thank you for being here, and thank you for taking the time to listen to my story.